Hi, I'm Nancy Zionkowski. I'm an occupational therapist, and I'm at Ohana Care Maui today. We're going to talk a little about dysphagia. Dysphagia means difficulty swallowing, and some people have difficulty chewing and swallowing foods, and they're at risk for what we call aspiration. Aspiration is when the food that's supposed to go down to the stomach, to the esophagus, gets caught in the airway. And we've all had this happen to us. We've had a lifesaver in our mouth or an ice cube and it accidentally goes to the back of our throat before we're ready, or we have a little sip of water and it goes down the wrong hatch. That's kind of a mini aspiration. So we want to avoid that with our patients and help them be very safe in eating. So we're going to go over some aspiration precautions, things you want to do to prevent a problem with the food getting in the wrong place. One of the first things we want to do is use gravity. If you're laying backwards in the bed, the lower you are, the more likely the food's going to go to the back of your throat before you're ready. So we want to have the bed at least 45 degrees. Simon's at 45 degrees. That's safe. But safer yet would be 90 degrees if the patient can tolerate it. So you want to have the patient sitting upright as possible. And for most folks who are a little weak, they may not be able to be upright all, and this might be as far as they can go, but we don't want to go lower than this. And we want to keep them here while we're feeding them, and we also want to keep them here about 30 minutes after the meal, so that if there's anything residual in their mouth or in the back of their throat, they can kind of clear it. So that's what we want to do for that. Well, how do we treat dysphagia? We keep the patient in a good position, head of the bed. We also, when we're feeding them, we try to have them in a chin down position. So when we bring the food to them, we try not to stand up to feed them and make them put their head back. When they put their head back, it opens the airway. So we kind of keep the chin in the midline. We want to have the patient eat in the middle, so we don't have them turn their head to us when we're feeding. We try to bring the spoon to them, to the middle. There's all different kinds of diets we use to help the patient with dysphagia, and there's special feeding techniques and special equipment we use as well. But our goal here is to get the patient to have good nutrition and to eat safely without aspirating.